Good afternoon, everyone. Again, we are here for another session. Today, it's a very interesting session, by the way, because in medical cannabis, we have always discussed about one challenge which many doctors are having, that is the dosage. How to decide the dosage. Generally, the medicines are in tinctures form, in liquid form. So, patients are also sometimes not able to take properly. The sublingual, they have to just press the dropper. So, although in with respect to the bioavailability, the sublingual form of cannabis is one of the highest available form for the body. Still, in Indian context, when we are talking about Indian practice, there are several challenges we need to understand. Just a second. Yeah, so there are several challenges which we need to understand as far as Indian scenario, Indian practice of medical cannabis is concerned. So what happens is in India, when we see that first is the patient compliance. So definitely the certain class, the certain group of patients are able to compliant well, but there are certain groups and certain age groups sometimes they are not that much comfortable as far as tinctures are concerned. As I said about the dosage standardization, some are not comfortable with the taste. Some are not comfortable with the price as well, because generally the 30 ml bottles are having the range of say 2500 to 3000 or more than that as well, depending on the potency. And 10 ml bottles are also in the range of 1500 or 1200 sometimes. Now, then when we realized this, I think few months back. So we understood these challenges when we started practicing medical cannabis exhaustively, and from several doctors we got this feedback. So finally, there are some products, and I again appreciate and congratulate and thanks to Ananta Hempworks for this kind of mindset, that they are very open and they always looking forward for having certain kind of innovations and certain kind of upgradations as well. So couple of medicines, pain relief capsules and Vijaya extract, Vijay 75 milligram capsules have been launched. And I think specifically I will talk about the 75 mg capsule here. The day it has been launched, it is a hit in terms of doctors, in terms of patient. I think somehow Ananta is struggling to meet the demand as well. I think maybe they have not expected this kind of demand. So again, I, on behalf of being a medical advisor of Ananta Hempworks, I apologies to all the doctors for having certain kind of inconvenience, which will not be there in future, as we have rectified certain issues, and Vikram will maybe throw some more aspects on that, because I think some doctors may be thinking right now who are connected with us that they are talking about capsules, but they are not able to fulfill the supplies, they are not able to fulfill the requirements. But I think those issues now have been rectified. And but this shows, this reflects this is a real time example that when we adapt and when we understand the issues, how successful we can be there. And in fact, I am seeing in my clinic also, I think this is one of the highest selling medicine right now, with, and it's an instant hit with the patient, especially patients suffering from pain issues, insomnia, anxiety, stress, and certain kind of inflammations. Many aspects are there. So people are reducing or sometimes immediately stopping their steroids, their painkillers, their sedatives, many other tablets and capsules they have immediately stopped. One more psychology we need to understand is, see, what happens is, in these days maximum people are taking medicines either in a form of tablet or capsule. So they are very much inclined to this kind of dosage form. And when we change the dosage form, sometimes also we have seen the mindset is not there. So if we are asking to take certain kind of medicine, and we are giving in Ayurveda also, we have seen we are giving certain kind of powder decoctions, syrups, or those kind of things, people are not that much comfortable. And with this fast life, with this people are moving here and there, now we have unlocked, so they are very much comfortable in just putting a blister pack of 10 capsules in their purse, in their bags, in their day-to-day life, to just carry with themselves across wherever they are going, and just pop up one or two capsules for the issues, for the health issues they are having. So it is a matter of convenience as well, and we can standardize the dose, we can have the set dose, that if we are able, if we want to give a 75 mg dose, so just 75 mg will go to that patient in a form of a capsule, not more than that, not less than that. So that is the beauty of this kind of dosage form when we decide. So when we talk about the topic today is cannabis in capsules, why we have thought about this, why we are doing this session today, just because as India is evolving in terms of the medical cannabis practice, doctors are more and more adopting medical cannabis in their clinics, in their practical aspects, with their patients. The various dosage forms are getting significant, and in that, I think capsule is one of the most important dosage form which we need to understand. Although, as I said, if we talk about bioavailability, certain amount of active ingredient of this particular herb will get destroyed when it will be getting through the gastric juices, when we are ingesting it through the digestive duct. So definitely the bioavailability a bit reduced as compared to the sublingual or the oral form. And also we need to understand that like as far as the capsule form is concerned, so one is the bioavailability is getting decreased, second is mild level of gastritis can be there. So that you need to understand, and whenever you are giving edibles, whenever you are giving capsules or tablets, as far as the medical cannabis is concerned, you have to be a bit cautious in those aspects. Otherwise it is very safe, it is very convenient, and patients can easily take this. Second, also we need to understand, sometimes we need to reduce the dose or we need to increase the dose as well, which we can do easily in a form of a capsule rather than the other forms. So that also we need to understand. And third, very important aspect is the cost. So generally capsules are ranging in a range of 400, 500 to 700,000, under 1,000 basically. The capsules are there as compared to the tinctures or other form of medicines which are more than that. So when we are, and it's a convenient in terms of sometimes patients and sometimes people also wants to try for say 10 days or 15 days, and then they want to continue, or maybe they are thinking of getting it long term. As far as medical cannabis is concerned, the medicines are concerned, so for that 10 days or 15 days bracket also, we can have these 10 or 30 capsules packaging. I think we have two kind of packagings for several capsules. One is 10 and one is 30. Vikram will have more like insight on this. So, as per my experience and my knowledge, as per my clinical practice, we are using both. So, if any other form, maybe Vikram, you can clarify. So, my point is that as far as the capsules are concerned, they are having these kind of advantages as well. Now, there are few more aspects which we need to understand as a doctor, as a medical practitioner, and when we are conveying this to the patients, that is very very important. One is when we are giving them in a form of capsule, so again, the exact number of capsules which we are prescribing, the dosage is very very important. Like for example, if we talk about 25 mg capsule, one BD or TDS or 2 BD also is fine, depending on how the patient is having the condition. If it is acute, if it is like mild or moderate or severe, on that basis we can decide that okay, 25 mg twice or thrice, or like BD can be there. However, when we are giving 75 mg, one OD or one BD is fine. So it's like you can decide the dose, and it's better to start. If we are giving 75 mg, what we are doing is we are starting with the night dosage first. So patient while going to sleep at bedtime, they are taking just one capsule, and after dinner, and that is fine for a few days. And then gradually, if pain is more, in fact, some of our patients are taking one twice a day, one BD or one TDS thrice a day as well, depending on their issues, depending on their acute conditions, depending on the inflammation, if pain management we are talking about, depending on the quality or quantity of sleep, if we are talking about insomnia, certain digestive issues like ulcerative colitis or IBS also is having very good result. Like in terms of cannabis is concerned, cannabis is having very good result in terms of managing these kind of colitis, ulcerative colitis or IBS as well. And in that, in fact, edibles are working. However, sometimes patients can have constipation as well. That you need to understand when you are giving high dose of edibles, high dose of these capsules or tablets. As far as the cannabis is concerned, patients can have constipation, certain kind of dehydration. So empty stomach, please avoid. After always give after meal. And second is ask them to take plenty of fluids, water, and fibers in their diet, so that this constipation issue will not be there. Otherwise, there will not be much side effects and much issues as far as capsules are concerned. So, in fact, the advantage of capsules is, as compared to the tablets or the raw powder and all, it is having the shell which where it will not get that much of issues in terms of gastritis, in terms of the stomach disturbance and all that we have seen in the form of tablets or powder form. So that we need to also understand, and accordingly we can prescribe them, right? So that is one aspect which we all as a doctor can understand. And by the way, the best part of the capsules is you can include with your other medicines. You can give 2 to 3 medicines in Ayurveda treatment protocols. Generally we are giving 2 to 3 medicines in which we are adding just one capsule, and then we are also giving the other form. We were getting some questions as well. I request all of you keep on posting your queries and question so that we can discuss accordingly. A couple of questions we can take right now, and maybe some questions we can take after Vikram can have his part of discussion today. So one point which is mentioned is the most important issue mentioned is supply of this medicine. So yes, definitely most of the time it breaks the medical course. So yes, if we are giving the capsules, if we are giving the tablets, this problem we can address, so they can take on regular basis, and accordingly it will be beneficial for them. Second aspect Gaurav has raised about the price gap. So is there any price gap between capsules and tincture oil? To be very frank, it's not much as far as the mg. If you calculate the cost of per mg, as per my knowledge, however Vikram can have more insight on this particular question, but as a clinician if I see, and for this particular question, so there is not much significant difference in terms of per mg dosage of cannabis is concerned. If we compare, like for example, 75 mg capsule and the 75 mg if we are giving through tinctures, in fact many times tincture will cost less as compared to the capsules. However, the problem is tincture is coming in a bottle of say 10 ml or 30 ml, so the total amount is a bit more. That is one thing. That's why some people are having hindrance. Second is, again, always it's not about amount, it's about the convenience, it's about the psyche, it's about, but we have seen to many patients, in fact the first time when we are introducing or adding medical cannabis to any regime, to any patient, first time in their life they are having this without any background, without any prior knowledge. So what we have seen with tinctures, they feel a bit uncomfortable as compared to the capsules. And when we have given them the capsules and they're seeing the healing, then it's very easy to convert them from capsules to tincture. That also approach we need to understand, because ultimately end of the day, as a clinician I feel that tinctures are the best options which we can give. However, sometimes we have to give other forms as well. So it can be the mindset, it can be the resistance, it can be the flavor, it can be the cost, it can be any issue, any bottleneck which stopping them. In fact, our staff is trained. Generally, when I prescribe somebody a tincture and at the dispensing counter, my staff feels that they are avoiding or they are maybe not taking because of the cost or some other issues. They quickly switch them or ask them, and in fact they get the approval from me as well in real time that can we give them the capsules. So that thing also sometimes works, and we have seen in our practice that many times those patients on one side getting negative due to the cost or due to the tincture form, and they were not adopting medical cannabis. By this approach, that at the time of dispensing, if staff is able to judge, and immediately they are suggesting them the capsule option. In fact, sometimes I also ask as a practitioner, as a clinician, but sometimes maybe due to sometime rush in the OPD or due to my thought process that I have to give them the tincture, I have not discussed with them. Generally, it does not happen, but sometimes it happens depending on how we are counseling the patients, right? So when we have when we have prescribed, and at that level of dispensing, if the staff is realizing that they have some hindrance or resistance for tincture, but capsules they are adopting or they are taking, that approach is also very good. In fact, with that approach, we are able to convert more and more patients into medical cannabis practice rather than previously when we had only tinctures. So that also a real time example, real time scenario which I am giving to all of you, which you can implement in your clinics. That on one side, if you have tinctures, but if you are seeing that some people are avoiding them or some people are having resistance, maybe any reasons they have, you can ask them to at least start the capsules, give them the 10 pack blister packing initially to start with, ask them to try, and accordingly they can take it forward and they can give you the feedback. Yes, it is working for them and it's fine. In fact, sometimes some people are doing like generally in blister packing, what we are doing it's a general practice in India that they are cutting that blister packing, or maybe they are giving 5 capsules for maybe for 4 5 days. and when they are trying and they see okay it is fine, then they are taking again another lot. So that is also there, which is not advisable as a standard practice, but many people are doing that as well, and it depends on your practice how you are dispensing the medicines. The only thing and the only issue here is that they should get the flavor, they should get the experience, they should get the results initially. And these medicines are working very fast. Within few days, initial few days, patients are coming to us and saying that first time in their life they are having this kind of relief, right? So that aspect we need to understand, and accordingly we need to practice as far as medical cannabis in capsule form is concerned, right? So I just take a pause here, and I request Vikram to throw some thoughts on this particular topic today about the product, so that you will be more interested and more aware about their medicines. And I also request all the doctors who have joined today, that you can always request for samples and complimentary samples for all of you from the Ananta Hempworks. So you can quickly just write down your name or email ID or mobile number, whatever you want. We will share that. We'll ask the Ananta team to send you the samples of these capsules and tablets, and accordingly then you can include in your practice as well. Over to you, Vikram. Thank you.
Hi, thank you, Raksab, and thank you for all of you to join today again. I hope you're bringing in some useful information for all the doctors. I'm founder at Ananta Hempworks, and our company's vision is to bring in more and more medicines on cannabis only, and more delivery systems, and by understanding that what a doctor needs. So it's a evolving process for us right now. We started this company with just tinctures before, and we tried to target certain ailments and certain areas with different tinctures. Then we learned that tinctures are expensive, and currently to bring down the cost, there's not much of an opportunity available where we can cut down the cost by 30% or 40%, which will make a difference. And then also we realized that with the doctor community, that cost and economics is also a big problem. And it's sometimes very difficult for a person to buy a 2,000 or 3,000 rupee tincture. So we try to solve that by bringing in the 10 ml tinctures, but then the duration becomes the problem. Also, another problem which we realized with the doctor was that when you buy a tincture, generally the dosages are between 4, 6, 8, 10, 12 drops. And a bottle, when you buy a bottle of that and you have a dosage of, let's say, 4 or 6 drops per day, the bottle lasts you for more than a month. And the treatment is only supposed to be given for 5 days or 7 days. So the patient is left with an extra medicine, and sometimes it's not in for their use. So after deciding and discussing a lot with Dr. Piyush Ji also, we decided to come into these capsules formats. Now, as he's already explained, but I'll just reiterate the whole thing. The capsules which we are making, which you can see on the screen, the pain relief capsule is a 25 mg capsule. It's for low to mild cases, and the 75 mg is a decently sized mg capsule, and is used in chronic cases like insomnia or pain and other lifestyle disorders. The idea to do this is that we take out a 10 strip, so that first, that if there is a short dosage in terms of you have to dose a patient only for 4 5 days, that can be taken care of. Second, the capsules can be cut down and can be used by the doctors if only a 1 dose or a 2 dose can be given, which is not possible in the tinctures. And difference in 25-75, definitely we had a great response of these capsules, and we're going to come out with a higher version and probably a middle version of 50 mg also, so that any kind of a combination in a formulation when you're treating a patient is possible to give in this. Yes, we've got very good response, and we were not anticipating this kind of a demand for these capsules. So we had only started with a test batch in which we had made some numbers of these capsules, but that got over 1/10 in the time what we were expecting in. And that's why with some doctors and even Dr. Piyush, we had a stop gap, and there was a problem that we're not able to supply the medicine. But that problem we have solved completely now. And it's not about the manufacturing material, or that we can't do it in 2 days. It is the other processes, which take some time. So now we've increased that quota, and now we will not be stocked out of these capsules ever. So maybe as a company we'll make sure that there is no gap in that, because I completely understand that it's a patient illness related issue. And if a doctor, on our confidence, on the confidence of the company, has prescribed a medicine to a patient, the patient is getting healed by it, you cannot stop the medication in the middle. The doctor's reputation also goes for a toss. As a manufacturer, my reputation goes for a toss. And more than that, and I believe that both these things are still less important. But more than that, the patient who's ill, who's suffering, he doesn't get the medicine. So it's not fair on them. So we will make sure that this kind of a thing and the supply chain is always maintained, and this problem is never going to happen. This problem is not there in the tinctures, but yes, tinctures have their own market and sizing. So the advantages going forward, we'll be making on different MGs, and the advantages directed dose, of course, and the taste issue is also taken care of. Sometimes a lot of patients are not able to take the taste when you take it sublingually and you ask them to hold for 30-40 seconds under their mouth. Some people are not just able to do it, and the directed dose is better. Even if the bioavailability of the tincture is more, but I think the capsules work and they work very very well, and we are proof of that. Dr. Piyush will agree with me on this one, I think. So as a thing, this is what we have. I'll just show you. These are the two capsules which we have: pain relief capsule and Vijaya. Except that we have we in the classical formulations also we're coming up. We have a tablet format of Lokia Vijaya. We are coming out with a tablet format of Kameshwar Modak and of Jati Filadi Churan. So it's a easier dose, easier one to take. The whole modak or the churan, even it's done in a powder form, it's sometimes very difficult to take. So capsules and tablets are a very easy format of a delivery system, and that is what we are trying to achieve with this. Also, in the future, all the other formulations also which we are doing, and the existing tinctures which we have, we will have a capsule format for that. And it's just a double delivery system. So somebody wants a tincture format, they can take the tincture format. Somebody wants a capsule and delivery format, they can use with that. So that is the idea of the of providing you doctors with of multiple delivery systems, so that you have all the kinds of the bouquet we are creating in the medical cannabis line. That bouquet should be good enough, and it should be covering all your requirements. That is the reason we have come out with roll-ons applications. We have come out with muscle and joint pain roll-ons, cramp reliever roll-ons. So we are just trying to find and learn with the market and get a feedback from the doctors. The doctors which I'm connected with, I take a regular feedback from them, that what problems are they facing, in what line, what medicine is working better, what medicine is not working better, and if this medicine could have been this, probably it would have been better. So then we work on it like that. And I hope that in the future we are able to bring you better and better medicines, and we are able to cater to all the kinds of needs as far as the medical cannabis is concerned. Thank you all for joining. Again, I'll just pass on the session back to Dr. Piyu so we can start answering the questions which I can see on the screen.
Yeah, thanks, Vikram. And I think really these medicines are helping patients, and which we are seeing in our clinic as well.
Yes,
So,
we just didn't anticipate the kind of response we got.
right.
If you would have anticipated that, then probably this problem would have never happened. But I'm sure that it's not going to happen ever, because it's a very sensitive
And I
patient
think now it
relationship.
has been resolved, right?
Sorry.
I think now it has been resolved. Now all the stock is
Yeah,
available,
it's been
right?
resolved. It's over a week that has been resolved now, and the supply chain is already set. And in fact, now we want to come out with different MGs now. So we are focusing more on that. And yes, supply chain will not be a problem at all.
Great, great. So the next question is: patient is suffering from varicose vein, having pain in legs. They can't stand for more than 20 minutes. Is cannabis have good results in such cases? Great. Yes. So, see, as far as these kind of cases are concerned, varicose vein, there are two, three line of treatment, Dr. Mittal, which we can have in Ayurveda. So definitely, as far as pain management is concerned, cannabis is really effective, and we are seeing patients as well who are having certain varicose vein patients. So there are
So
two, three more line of treatment which
your
we
volume
can
has gone
have.
down.
Hello.
Yeah.
Yeah. So I was saying that as far as varicose vein is concerned, in pain management, definitely cannabis can help. And second aspect is in varicose vein with Ayurveda treatment, we have seen certain medicines and certain therapies are really working well. So one is the leech therapy, the Jaloka, which you can have as far as varicose vein is concerned. Second is there are specific medicines which we are using. So what I will suggest is maybe you can discuss on one-to-one basis as far as this particular case is concerned, and we can definitely help you out in this. I'm just sharing my number as well. But as far as cannabis is concerned, yes, Uh, this is very effective as far as pain management, and in varicose veins, we have given for pain management medical cannabis to the patients, and we are seeing very good results as well. So yes, you can use that, and accordingly you can take it forward as far as cannabis is concerned. You just shared my number also. Okay, so now there is one question. I think you have mentioned about this, Vikram, about the costing in your discussion.
No, I like to take that. Yeah. So
Please, please. So
I
there
think
is
the
one
doctor.
question as far as the pricing of capsules are concerned. So maybe you can just quickly again add the slides and talk and specifically mention about the pricing so that the doctors are aware. And second, also meanwhile, you people also share your contact details, email ID, your number also, so that
I don't have a
doctors can connect. And,
Yes, I don't have a
yeah.
slide for the pricing, but Dr. Gaurav's question, I would like to answer that and explain how it works. So when you're making a tincture,
Please,
you are,
just a second, please. There are two aspects which you need to explain. One is the question which he has mentioned about the price gap in terms of capsules and tincture oil. So that is one question which you need to answer. Second is
yes.
also specifically we are getting some queries about the MRPs of these products, which you can also clarify to the doctors what are the MRPs
I'm
or cost to the
I'm
patient
sorry, I didn't
as far as
understand the
the
second question, Dr. Saab.
MRP, the cost to the patient, what are the MRPs of these products? That also please explain. Thank you.
Of tinctures and the capsules, right?
Right.
Yes. Okay, so to answer the first question, Dr. Gaurav, why is there a gap in the capsule and the tincture? Because a minimum quantity which you make in a tincture is a 10 ml, and then generally the maximum tinctures which we sell are of 30 ml size and a 50 ml size, because that's the cost economics for a patient who is using the tincture for a longer period of time, or who has to be given this medicine for 30 days or 45 days, which is a very common scenario. Now, when you make a tincture, what happens is that, let's say we are doing a pain management tincture, which we have, which is a 10% potency. What it means is that in a 30 ml bottle, 10% of the 30 ml is the Vijaya leaf extract, which comes to 3 ml. Now, the costing of the most expensive item which is put in these tinctures or these capsules is the Vijaya leaf extract. Now, the 3 ml Vijaya leaf extract, is the direct cost of the 3 ml Vijaya leaf extract, which costs us, which is the maximum one which we do. Then to carry that oil for 30 ml, minusing from 30 ml, 27 ml oil is mixed, which is the hemp seed oil. So that's the second component which is used to make the tinctures. After that, then you need to do a proper clean bottling, which happens in a sterile environment, and everything. The bottles are filled with that. Then you do a plastic packaging on that. You put labeling on that. Then you put a mono carton on them. So this is the cost process of this, and why? Because of 10% 3 ml, it happens. The cost goes up. Now, capsule difference is there from capsule economics is there from mg point of view. Now, 25 mg, a 25 mg dose in a capsule is 25 mg of cannabinoids, which is your Vijaya leaf extract, and then the balance. It's a capsule is about, I think, 500 mg, and the balance 475 mg is just the hemp seed powder, which is actually a nutritional item. It's a pro protein, it has vitamins and everything, and it's mixed with that and done into a capsule. Capsules cost less than compared to bottles. The finishing, labeling, and the packaging of the tinctures is more expensive than the capsules. So when we make a 10 capsule strip and just blister it and then just pack it into this mono carton, my without the medicine cost, also the packaging and delivery cost is almost 50% less than the tinctures. So that's one effect which comes into that. And then secondly, in a 10 strip 25 mg capsule, the medicine which I've used is only 250 mg. So the 250 mg 10 piece capsule, and if you make it compare to a 10 ml or a 30 ml tincture, you will realize the cost difference is huge. And this is one of the main reasons why we actually took out the capsules. And the capsules are so directed, and they work better. It's exactly the same reason. So that is the main point where the difference of pricing comes into play. As far as MRPs are concerned, so from our tinctures, our 10 ml, the cheapest tincture is the stress-free one, which is a 5% potency. I think it's priced around 1149. And the highest tincture which we have is a 50 ml bottle of a pain management oil, which costs 6,000. But that's a 50 ml bottle. We generally only give it to patients who know they have to regularly use it. So when a 6 drop twice a day happens with a patient, and he has to take it for 2 months, then neither the capsules nor the smaller tinctures will make any sense to them in terms of economics. Then they should go for the 50 ml tincture, because 12 drops they're taking every day. So that is almost about less than 0.75 of a ml every day. So that will, the medicine is going to last for more than 65 days. And if you divide the money with that, and then you see the comparison of a 6,000 rupee bottle, that is where the economics starts coming into play. The capsules which we have, the 25 mg is for 349 for 10 pieces. So that, each capsule costs you about 34 rupees. And the 75 mg which we have is for 599. So that costs you about 59 rupees for a capsule. So, or a shorter duration, if a person needs to be dosed only for 2 days, 4 days, 5 days, or he doesn't like the delivery system of the tinctures, then it's an alternative for them. And I think that alternative is really working well. So, a lot of patients and even doctors are finding it easier, and patients are also finding it more effective in terms of taking capsules because you don't miss it. Secondly, it's a pack. I mean, it's very easy to carry. So, the capsules have an advantage over the tinctures, or like that. You can have multiple places. If you're taking it, one can be kept in your office, one can be in your car. If your timing is like that to take the medicine, tinctures you'll have to carry the bottles. So and if you break the bottle in the middle, then it's a big loss. So these things are there, and that these are the pros for having a capsule in our option. But yes, the price point right now is there. We're working very hard with the National Association also, and if we get the right support from the government, which the government is now showing a lot of positive result and positive intent also in a lot of states, and they give us the right cultivation licenses with the right policies, I can tell you, if the policy and chapters come into play now, by the end of this year, I mean, they will not come into play by now. It will take this year to come into play. But if they come into play now, it will only take 6 months to 8 months for every company to reduce the costing of these products by at least 30-40%. And then it will be very, very affordable. And the capsules will be way more cheaper, and the tinctures also will come into a range where people are not going to find it expensive. So that's my 2 cents on that. Dr. Saab, back to you.
Right, right. I think thanks, Vikram, for this clarification, and hopefully, like people are now aware about the exact scenario. So thank you so much again, all of you, for joining today. It was really very much supportive. Every time I can see right now, also more than 170 doctors or another people are joined us on various platforms via live. So we will be coming up with some restructuring moving forward. We'll be discussing internally with Ananta team, and we'll be coming up with certain other restructured model of this kind of training, so that we can have more and more engagement and involvement from all of you. And now we are also thinking to have some kind of a panel discussion and some kind of maybe involvement on more doctors who are practicing medical cannabis. I think, Vikram, let's start these kind of sessions now more, in terms of getting
Yes.
more and more doctors who are practicing. So because we have set up the stage, and now I think many doctors are actively involved with you guys as well. So moving forward, what I suggest is let's have a few more doctors involved in these kind of sessions. Let's understand about their thought process and maybe their experience and their case studies, and accordingly we can take it forward. So there is one more question: what is the availability of CBD patch for pain management? I think some organizations are developing that, including Ananta, as far as CBD patch is concerned. And as soon as it will be available in the market, definitely we will also post and promote in our platforms as well. It will be really a nice, interesting product to watch and take upon. And we will be definitely connecting you, Rajat, with any company who will be launching this as soon as possible. So on that note, let me again thanks to all of you, and we'll see you next in the next session. And let's have more and more involvement and engagement with other fellow practitioners also. And
Yes,
I
let's start
request
doing
each
more
and all of
interactive
you.
sessions, Dr. Saab, where we can involve all these doctors for a live conversation, and answer
Right, right, right.
answer the questions live. Let's start
And I
doing that. Yes,
request
that's a
all
good
the
idea.
doctors who are watching right now, if any one of you is already practicing medical cannabis, you can also write to us, and we'll be happy to have you in these kind of sessions as well.
Sure, sure. I'll
Right.
just like to
Right.
answer Dr. Rajat's question. There's no company manufacturing a CBD patch right now. Work is going on, but it's not going to be a CBD patch, Dr. Saab. It will be a full spectrum Vijaya leaf extract patch.
Yes,
So
yes, yes.
please understand that difference, because isolation right now in India, anyways, under Ayurveda is not allowed. So when you say CBD, I think you're meaning that the Vijaya leaf extract. So it will just not be CBD; it will be CBD, THC, and the natural ratio which is found in India. So those patches some companies are working on, and I think it should be available very soon.
Yeah, I think CBD is a kind of a synonym or maybe a
Yes,
like
yes,
word used commonly for the medical cannabis medicines in India. You are
yes.
absolutely right. Isolation or broad spectrums are not that much like legalized till
I
now in
think it's
India.
just
But
gone to
yes,
people's mouth. Just like when you say Pepsi, it means a black drink. You don't have to specify
yes,
if it's Coke or Coke Zero, or what is the difference. But yes, CBD, I think in India relates to that.
right. Great, great. Thanks,
All right.
Vikram, and thanks, Raji and Gaurav and everyone else
No,
to
no.
get involved
No, no, thank you, Dr.
in
Saab.
this.
Always appreciate the effort and the knowledge you bring in, and we are. I hope you're able to provide some information to these doctors. And it's lovely to see everybody. I think Thursday are working out better. So, like let's meet on next Thursday, and we'll be coming
Sure,
up with another interesting topic. And till then,
sure,
please have a great week.
sure. Thank you
Thank
all.
you.
Thanks.
Thank you, Dr. Saab.